Spinal fusion is a surgery that joins two or more vertebrae in your spine together. It's like creating a bridge between these bones, making them one solid unit. This stops movement between the vertebrae, which can help reduce pain and improve stability. Imagine your spine is like a stack of Lego blocks that keeps moving and causing you trouble. Spinal fusion is like permanently connecting some of those blocks to make them stable. This procedure is often recommended when more conservative treatments, like physical therapy or medication, haven't provided enough relief. It's a major surgery, so it's important to understand why it's done and what to expect during and after the procedure. Spinal fusion is often used to treat a variety of conditions that affect the spine. One common reason is scoliosis, a condition where the spine curves abnormally. By fusing the curved vertebrae, surgeons can straighten the spine and prevent further deformity. Another reason is spinal instability, which can occur due to injuries, degenerative disc disease, or tumors. This instability can cause pain, weakness, and difficulty with movement. Spinal fusion can help stabilize the spine and alleviate these symptoms. Herniated discs, which occur when the soft cushion between vertebrae bulges out and presses on nerves, can also be treated with spinal fusion. By fusing the vertebrae above and below the herniated disc, pressure is taken off the nerve, relieving pain and other symptoms. Before the surgery, you'll be given anesthesia to make you comfortable and unaware of the procedure. The surgeon will then make an incision, usually in your back, to access your spine. The next step involves preparing the vertebrae to be fused. The surgeon will then carefully place a bone graft, which could be your own bone or a donor bone, between the vertebrae to be fused. This graft acts like a bridge, encouraging new bone to grow and fuse the vertebrae together. To hold the vertebrae in place while they fuse, the surgeon will use metal plates, rods, or screws. These are usually left in place permanently. After surgery, you'll likely need to stay in the hospital for a few days. Recovery time varies, but it can take several months to fully heal. Physical therapy plays a crucial role in regaining strength, flexibility, and mobility. Like any surgery, spinal fusion does carry some risks. These can include infection, bleeding, nerve damage, and pain at the bone graft site. It's important to discuss these risks with your doctor to make an informed decision. While there are risks, spinal fusion can significantly improve your quality of life in the long term. It can reduce pain, increase stability, and improve your ability to move and participate in daily activities. Remember, everyone's experience is different, and it's crucial to follow your doctor's instructions for a successful recovery.